This is the injury report presented by NYU Langone Health. The big bodega, Karl-Anthony Towns, missed his third straight game because he's out with the jumper's knee. So in today's injury report, we have Dr. Guillem Gonzalez-Lomas, sports orthopedic surgeon over at NYU Langone Health, to break down exactly what in the world is going on with Cat's knee. And I feel like this could be Tibbs' fault, but we're gonna get your words on this, Doc, because you're the professional when it comes to this one. So the official name of the injury for you folks watching at home is right knee tendinopathy, but all us hoopers and athletes call it jumper's knee. Can you kind of break down the injury in medical terms and how you would describe that to one of your patients?
Yeah, absolutely, Brandon. So if you played ball, you've probably had this injury. And like you said, called jumper's knee. The word tendinopathy is kind of a generic word for a tendon injury. So that in itself doesn't give us too much clarity, but there's two different flavors of this injury. You could have tendonitis, which is a little bit more acute. So that would be something that just got irritated, and there's inflammation of the tendon, typically where the patellar tendon attaches to the kneecap. So the patellar tendon is that tendon that connects the kneecap to the shin bone. You can also, if you ignore the injury for a while, develop something called tendinosis. And that actually involves a little bit of degeneration of tendon tissue. And again, it's in the same area, but that's a little tougher to deal with, and that's a little bit more chronic.
Doc, we're talking about the same injury, but not the same knee that kind of forced him out of the lineup earlier. We're earlier this season. We're still early in the new year, and Knicks fans are hoping that this team can go on some sort of deep playoff run. So he's questionable, or listed as questionable, tonight against the Raptors. Let's say we're talking a playoff game. Is this something, could he have played through this tonight?
Right. I mean, look, that's a question, obviously, that only the player and the training staff and the medical staff know. But the problem with this injury is that it starts off very insidiously. It's not like a big tear, an ankle sprain, where there's a moment where something happened. This builds up over the season. And again, going back to the name, jumper's knee, it's just that repetitive activity, that shear on the tendon, and it gets it inflamed. So a lot of times it's really a judgment call about when you stop, when you decide to take some time off, shut it down, and do the appropriate rehab and any other modalities that the training and medical staff deem appropriate. But yeah, you could say in some of these cases, if the stakes were high enough, you could probably try to play through it. The concern that we all have with playing through pain is that you can make injuries worse.
Yeah.
So I think in general, it's smart if a player feels like they're not performing at their optimal, it's a good idea to shut it down at that point.
You talk about it being like a repetitive action. He's playing for a coach that gets a lot out of his players. We're talking about an athlete that's 29 years old. He's logging 34.6 minutes per game here in his first season here in New York. That's the most since the 2017-2018 season, back when he was a young buck with the T-Wolves. Tom Thibodeau is known for giving his stars a lot of game action, Doc, and that can tax their bodies. So do you think that all that game action, 34.6 minutes, could be running Cat's knee into the ground?
Yeah, look, it all factors in. And again, we only see players when they're playing the games, but there's a lot of practice. There's a lot of rehab that goes on behind the scenes. So, look, as always, you're trying to ride that fine line with optimizing performance, getting people as fit as possible, but not overloading them. And that's really the difference between a successful team and an unsuccessful team. You want to be as close to that point as possible without injury. So sometimes, and it's just, it can be just bad luck. Sometimes you can have a little bit of excessive training or excessive game time that just tips you over the edge, and combine that with a little bit of bad luck, and then you have an injury.
To the people watching right now, jumper's knee, as Doc said, is something that's just so common in athletes, not just hoopers. So, Doc, let's say to all our hoopers and athletes that maybe play ball at the Y or maybe at the parks, let's say they suffer that same injury. What advice do you have for them to get healthy, since they don't have you or a Knicks training staff at their disposal?
Yeah, well, obviously, always happy to see them. But like you said, this is a ubiquitous injury. If you've played any kind of jumping sport, you've probably had a little taste of it. First thing is if you feel pain and it's not getting better after resting overnight, if it's something that lingers for a few days, good idea to stop the activity, the offending activity, let it calm down a little bit. You can always try some anti-inflammatories for a few days. You know, your standard Motrin, Aleve, and compression knee sleeve can sometimes help. But if it hasn't gotten better in a couple of weeks, it's a good idea to see a medical professional, get the right diagnosis. Physical therapy does wonders for this. We could get into the exact modalities, but there's a lot of ways to treat it. And we even have some other biologics, things like injections that we can throw at very stubborn cases. So there's definitely hope for all of us, whether NBA pros or just regular civilians.
Hope for the civilians and Knicks fans are hoping Cat gets back out there ASAP. Doc, thanks for jumping on with us today. No pun
You got
intended,
it. Oh,
jumping.
always a pleasure.